Good afternoon, everybody. My name is Joshua Hudson. I'm from Bay Mills Indian Community. So to tell you more about me, actually, before we jump into that. So how many people are from California? Can you raise your hands? Most of the room. Okay, good. So how many people know how many federally recognized tribes there are in California? 109. There's 573 federally recognized tribes across the nation. Over 100 are in California, so there's a good chunk here. Sacramento is currently and ancestrally the homeland of the Nisenan, Maidu, Miwok, Patwin, Winton, and Wintu people. So we need to take that into consideration, that this is, and everywhere across the United States of America is native land, but a lot of times we're left out of conversations. So with that note, my name is Joshua Hudson. I currently serve as the program manager for the National Native Network, which is a CDC national network to address tobacco and cancer. So that's my day job. But I was elected in November 2017 to my tribe's Court of Appeals, so I'm an appellate judge. And then in November 2018, I was appointed by our tribal council to be the judge for our Healing to Wellness Court. So I'm here to talk about cultural teachings as a protective factor, and holistic perspectives for healing and recovery. So I don't have a clicker, so if we could go to the next slide. So this picture up here is my community, Bay Mills Indian Community. That's Spectacle Lake in the foreground, and then in the back there's a line that's Lake Superior, and then the darker line above that is Canada. So I live really far north. And as anyone who's listened to me today, I'm like, we get really harsh winters. So it is what it is. I didn't grow up in my own tribal community. I grew up in a different tribal community in central Michigan, but I live there now. And one thing that I've seen is one thing that I've experienced is we're in a very rural area, and we struggle a lot with a lot of different things. In my group, we were talking about stigma, and how can we address stigma? How can we do these things? And where do you meet people? And I was like, the bar. It's really harsh winters. That's how a lot of people get by. I don't go to the bars anymore because I sit on court and I don't want to have awkward exchanges, so I just don't go to the bar anymore. But I want to highlight that my tribal community is not unique in the fact that we've suffered a lot of loss. Not just with the opioid crisis, but loss in general. We lost a lot of our land. We've lost a lot of different things. We're typically forgotten about, and that's not fresh. A lot of that's really historical, and so really taking into account trauma. I know that a lot of people are talking about trauma now, which is great, but we need to also understand that trauma isn't always what we experience just in our lifetime. Sometimes we're dealing with the trauma from previous lifetimes. So we'll go to the next slide. So this is a picture of the Bay Mills Tribal Court with our symbol above that. So with Healing to Wellness Court, it's a drug court model, and we have a multidisciplinary team that discusses the cases of all of our clients individually when they report for court. So some background on me, I started my professional working career, actually with my whole career, I've worked either for tribes or a tribal organization. For my whole career so far, I started working out at a tribal treatment facility that was inpatient and had intensive outpatient as well. And then I worked at a youth home for a while, and then I did medical case management for a bit with an urban Indian health program. So I've kind of rounded out working in public health now in tobacco and cancer. So it's just interesting that I find myself now with Healing to Wellness Court. And so we've had a lot of turnover in our court too for a variety of reasons. But I'm the third judge in 4 years. So there's been a lot of changeover in the judges. And so I'm trying to help provide some continuity and some stability there. But I do bring the treatment lens with me. I'm not an actual provider, but I've been in and around the treatment and recovery community for at least the last 10 years. So I have a lot of perspective with that, and I have a lot of great conversations with our providers, and our team meetings are really rich. But One thing that we've done is included our tribal housing, because we're a small rural community. We have a housing shortage, which isn't new to a lot of you. There's housing shortages everywhere. So we're really incorporating our housing, but we're also incorporating our cultural department. Our cultural department is mighty. There's 2 employees. But we could get one of them to come. And so one thing that we've worked in terms of like sanctions and rewards is really incorporating the cultural element, and it's been relatively successful. Again, some of our community members don't really value or cherish our traditional ways through things out of their control. We've had a lot of colonization, especially around religion and missionaries. So there's there is some distrust of our traditional ways because it's been talked about being of the devil in the things. You know, that opinion's changed over time, but it's still going for some people. We'll go to the next slide, please. So, and we try to ground it in our teachings as much as we can. Again, we're a court system, and I'm a judge. I do want to, describe the process a little. When I go in, it is like a court proceeding, but I don't wear robes. I try to remind them that we're on the same level, even though the bench is elevated. I try to remind them that I'm not there as somebody to be punitive and to hold them down. I'm there as a fellow community member to help serve as an accountability partner for them, for our community. And one thing that I really try to remind them of is that our community would not be the same without them, that if we lost even one of them, the community would no longer be able to be the same. And, we would have to deal with loss, and death is traumatic for everyone who survives. And as I said, I live in a very rural, remote area, so by the time we get drugs up to us, a lot of, they're, 90% of the time they're cut. It's been, in our conversations that we've had, it's safe to assume that it's been cut and that it's not safe. So I wanted to round out with this last slide. It was created by a good friend of mine. Her name's Tasleen Van Hoddem, and she's amazing. And I do tobacco work, and so tobacco is actually traditional medicine. And we know what happens when you abuse tobacco. You have a lot of illnesses and a lot of ailments that will follow you. But around the outside, and I can't see it very well, but the 7 grandfather teachings, I wanted to include it because I can never remember all 7. But they're basic guideposts within our Anishinaabe teachings. So the top left is bravery, which is Akadewin. The top right is wisdom, Nibakawin. The middle right is Zagadewin, which is love. Bottom right is respect, Minajatuawin. The bottom center is truth, Debwewin. Bottom left is humility, Debandidtizuwin. And then the center left is honesty, Gwekawadizuwin. So understanding that these 7 grandfather teachings are core tenets, and trying to approach things in that way with how we interact with our fellow community members, because the judicial community hasn't always been good at praising. The judicial community does what it needs to do in sentences and holds people accountable. But the flavor and the process that I try to bring is humility and love and care and compassion, because there's not enough of that to go around. And we have to take care of one another, because if we don't have each other, what do we have at the end of the day? So with that, thank you.